Hi, I am Dr.Daneil. Many people think of ginger root merely as a fragrant spice for baking or a warming addition to drinks. However, behind the apparent simplicity of this unassuming rhizome lies a true natural pharmacy with a history of use spanning thousands of years. This remarkable root has the ability to reduce inflammation in the joints, restore normal function of the digestive tract, and, what may come as a surprise, effectively help with various forms of urinary incontinence in older adults. Today, I will explain in detail how to correctly use ginger to achieve maximum therapeutic benefits for the whole body, rather than simply adding it as a pleasant flavor to your morning tea. Hello, dear friends. My name is Dr.Daneil, and I'm a health expert for people over 60. On my channel, we regularly discuss the most important topics for maintaining health and active longevity. Before we continue, write in the comments where you are from. I'm always interested to see the geography of our audience. We'll be talking about a plant that has been revered for millennia as a universal healing remedy across many medical traditions. In ancient Indian medicine, Ayurveda, it was called Vishvabhasaj, which means the medicine for all diseases. Chinese healers used it to restore the body's vital energy qi and to balance yin and yang. Greek and Roman physicians prescribed it for strengthening the body and boosting vitality. Our discussion today is entirely devoted to ginger and its incredible healing properties. The title of this talk may sound bold or even provocative. Ginger can heal almost every ailment. Of course, that requires clarification. Ginger is not a miracle cure for late-stage cancer, nor can it regenerate lost organs or limbs. However, there is a deep medical truth behind this statement, supported by modern scientific research. The vast majority of chronic diseases, especially those typical for people over 60, share two fundamental pathological mechanisms: chronic low-grade inflammation and impaired microcirculation. Imagine the human body as a thriving country with complex infrastructure. Inflammation is like an internal conflict that slowly destroys essential systems: joints, blood vessels, nerve tissue, and even brain cells. Poor circulation is like damaged roads and bridges, cutting off the supply of oxygen and nutrients to distant tissues, while metabolic waste and toxins accumulate inside the body. In this metaphor, ginger acts both as a peacemaker, reducing internal conflict, and as a skilled builder, restoring damaged infrastructure. It effectively lowers inflammation and simultaneously improves blood circulation throughout all organs and tissues. When these two fundamental processes return to normal, many symptoms previously seen as separate diseases begin to disappear on their own. Joint pain diminishes or vanishes, digestion improves, and energy and vitality return. And perhaps most surprisingly, normal bladder control is restored in many patients over 65. My patient Valentina Petrovna, 72 years old, had suffered from frequent urges to urinate for more than 5 years. After 3 months of ginger therapy, she returned to a normal life. This is not a folk myth or placebo effect. It is a scientifically proven physiological fact. The mechanism of action is multi-level and comprehensive. Ginger's anti-inflammatory properties help reduce irritation and inflammation of the bladder lining in chronic cystitis and decrease inflammation in the prostate gland in older men. Improved microcirculation enhances blood flow to the pelvic organs, strengthening the muscles of the pelvic floor and bladder sphincter. Additionally, ginger has a mild antispasmodic effect, relieving tension in smooth muscles, including those of the bladder, the detrusor muscle. It also has a neuroprotective effect, protecting the nerves that connect the brain and bladder. By improving digestion, reducing constipation and bloating, ginger also decreases abdominal pressure on the bladder. However, all these benefits appear only if ginger is used correctly. Simply adding a few slices to a cup of hot water is pleasant, but insufficient for therapeutic purposes. You must know which form to use, how to prepare it, what dosage to take, and which other ingredients enhance its effect. In this detailed practical guide, we'll go from theory to practice. First, we'll analyze the biological mechanisms of ginger's therapeutic action. Then we'll look at its anti-inflammatory and vasodilating effects in detail, followed by its impact on the digestive and nervous systems. Finally, we'll reach the most important part: specific recipes and medical recommendations. The most powerful therapeutic ginger tea recipe Ingredients 2 to 3 centimeters, about 1 inch of fresh ginger root. Finely grated liter, 4 cups of clean water preparation. Place grated ginger in a pot with cold filtered water. Bring to a gentle boil. Then lower the heat and simmer for 15-20 minutes with the lid on. Avoid vigorous boiling. It destroys active compounds. Turn off the heat and let it steep for another 10-15 minutes. Strain through a fine sieve or cheesecloth, pressing out the pulp. This liter is your daily therapeutic dose. Store it in a glass jar in the refrigerator for up to 48 hours. Drink it warm throughout the day between meals, divided into 3-4 portions. Morning ginger shot for a powerful start to your day and to boost metabolism. Juice of 1-2 lemon, 2 centimeters grated ginger 1-2. TSP turmeric powder, a pinch of black pepper, improves absorption. TSP raw honey mix, all ingredients with a little warm water, and drink on an empty stomach. 30 minutes before breakfast. This is a potent anti-inflammatory and metabolic booster. Dosage and safety: daily dose, 1 to 3 g of fresh ginger, 2-3 centimeter piece. Avoid large quantities right before bedtime. Ginger is stimulating and slightly diuretic. Not exceed the recommended dose if you take blood thinners, e.g. warfarin, aspirin, Xarelto. Be cautious if you have gallstones, ulcers, or acute gastritis. Stop taking ginger 2 weeks before any planned surgery. Start with small doses and monitor your blood pressure, especially if prone to hypertension. For maximum results, combine ginger intake with an anti-inflammatory diet, rich in vegetables and omega-3 fatty acids, and do pelvic floor exercises to strengthen bladder control. Final thoughts. We began with the statement that ginger can help with nearly all diseases, and now we understand why. Ginger doesn't target individual symptoms like synthetic drugs do. It restores the body's core processes. It reduces chronic inflammation, improves circulation, supports digestion, and protects the nervous system. Used correctly, ginger becomes not just a spice, but a daily ritual of healing and rejuvenation. Would you like me to translate this into a natural, fluent English video script for YouTube narration with tone, pacing, and transitions? That would make it sound like a professional health expert's presentation.